Welcome to the COVID-19 Daily Update. I am Dr. Karen Gordon-Boyle, Deputy Chief Medical Officer. I now bring you the updates for Guyana. Of the 56 tests that were done today, there are 3 new cases, which brings our total number of positive cases to 248. We are pleased to announce that 116 persons have recovered. The number of deaths remains at 12. In institutional isolation, we currently have 120 active cases. In institutional quarantine, we have 16. Number of cases in the COVID ICU is 2. To date, we have tested 2,634 persons, with 2,386 being negative. Now for the global statistics. According to the World Health Organization, the total number of cases is 10,185,374, with 503,862 deaths. Regionally, the number of cases is 5,136,705, with 247,129 deaths. My fellow Guyanese, according to our statistics, regions 1, 4, and 7 continue to have most of the cases. I wish to inform the residents, particularly in regions 1 and 7, that the ministry is working collaboratively with the various agencies within the region to address and help arrest the situation that is threatening to spiral out of control. We are calling on all residents to cooperate with the health officials as we work to contain the spread of the disease in your communities. I wish to share with you the trauma of a near-death experience of Natalie, who managed to claw her way back to life after falling seriously ill with COVID-19. Here is her story. The first hint I had that something wasn't right was on Friday. I felt more tired than normal, and by the time I went to bed, I was exhausted. That was a particularly tough weekend. On the Monday, I started getting pains in my legs, which became excruciating. I thought it was a trapped nerve and took some paracetamol, but the doctors later told me the virus had gone directly into my muscles. I had a cough, but it wasn't persistent, which people think is always the sign. I was feeling freezing cold and shivering. At one point, I had 4 hot water bottles on the sofa and 2 blankets, and I just could not get warm. Then the fever set in. It felt like my body was on fire, and I was getting splitting headaches. I couldn't eat anything. I was vomiting and absolutely wringing wet with sweat. And then my breathing started to get more difficult. I'm asthmatic, and that really worried me, but I still thought I could ride this out at home. Within a few more days, I was slipping in and out of consciousness, and I have vague recollections of my 15-year-old son telling me he'd called 911 for me. The EMTs arrived, and I remember hearing on radio the ambulance driver outside saying, "She's very poorly. We need to bring her in." He put an oxygen mask on me and carried me out to the vehicle. One of my kids had called my mother June, and she was there watching. That was one of the hardest things, seeing the look of helplessness on her face, but she couldn't come close because she has a heart condition and is at high risk if she catches the virus. I felt pummeled. All I could think was, what the hell is going on? I felt like passing out. I remember another nurse coming over and telling me, "Just to let you know, your X-ray results have come back. You've got pneumonia in the lungs, and you'll have to be on oxygen 24/7. At one point, I felt the most almighty pain in my chest, like I was being compressed with slabs of concrete. They told me it was the pneumonia attacking my lungs, and they gave me a shot of morphine. That was followed by terrible, stabbing pains in my stomach, as bad as labor contractions. And I cried out, "I can't take this anymore. I can't carry on." By the time the pain subsided, I was almost delirious. I shared this excerpt to give you a vivid image of the pain and horror that a COVID-19 patient can experience. And we should note that it is not just the patient that suffers, but the family members that cannot be there for them. Guyanese, I want you to know that COVID-19 is real. Stop Mama Guyan. Please note also that the full effect of COVID-19 on the human body is not fully known. You can recover from the coronavirus disease, but may develop other conditions that you previously did not have, which can result in possible death. So my fellow Guyanese, let's follow the guidelines. We continue to say thank you to all of our health workers who continue to screen the population, provide testing for suspected cases, and treat the positive cases. Fellow Guyanese, we ask that you do your part and respect the curfew.